get started, Lieutenant Mays. Dwight, I do want to recognize we brag on you for all the grant work you do and how you've benefited the county, but you got a whole team, I think, that helps you and is behind you, and so I want to give you a minute to recognize them and talk about them.
And that's exactly what I want to address today. Over the last couple of weeks, I've gotten a lot of personal accolades and kudos over my promotion, and I thank y'all so much for recognizing that. And I've said it before, and I want to continue to say it. It's never just me. There's a lot of moving pieces to these things. I call them octopuses. And an octopus has got 8 legs, and a lot of times these things have got more than 8 legs. I was telling Robin just a minute ago, I'm disappointed that there's nobody here today to hear the recognition of our veterans. And Sherry's already brought up the issue of our teamwork here at the county, that nobody's here to hear that, but hopefully they're all out voting. And of course, with the bad weather, I think we can forgive them, but we'll pat ourselves on the back today. I want to use one in particular that we just did the reporting on. This is kind of how the subject got brought up, because I was talking with the judge the other day, and I said, people don't really realize what goes into one of these grants. A lot of people think that, hey, it's a wish list, and you get to write it down, and if you've been good this year, Santa Claus will come. Well, it's not quite how it works. There's a lot of things that have to happen. Just to get one started, first of all, y'all have to be willing for us to even apply for it. Charlene, she has to help me get that ready for presentation to go to the court. When it gets approved and everything, it has to be recorded down in the court clerk's office. There's all kinds of people that touch this thing, and I look around the room, just about everybody in here has helped me at one time or another on a grant. It may be 5 minutes, maybe 5 hours, it may be 5 days, maybe 5 months or more. I could have Becky stand up personally 6 or 7 times, because she has one of probably the dirtiest jobs. Once we get a grant, she has to keep up with the financials on every one of them. And we have anywhere from 10 to 15 grants going at any given time, anywhere from preparation and application stage all the way up to completion stage. Some of them are one-timers. It takes about a year to get them done, and then it's over with. Some of them take 2 or 3 years, as she brought up earlier. Usually they're all successful, but every now and then we have one that has been a battle, and that one has certainly been one for everybody. And she's still battling that, trying to collect that last money that CDC bailed out on us. But they're not easy tasks, and there's a lot that has to be done, and they don't get done unless everybody is cooperative. And whatever part they play, it's a very, very important part that has to take place, or you don't progress. But so all the times that y'all say thank you to me, I in turn want to say thank you to all of y'all, because without y'all, I can't get it done. And I just wanted the court to be aware of that also. So thank you all so much, Becky, you especially. I can't tell you enough, because without you it wouldn't happen. So appreciate every one of you. Just to give you an example, this one that we were talking about, we just did this our first year. The reporting that was required on this literally took Sherilyn a week of her time. I had about 2 or 3 days invested in it. And between all the other little pieces, I figured that we had about 2 to 2.5 weeks worth of man hours just to do the reporting part of it. So any of these are no small task. And I just wanted to bring that to light to the commission to say thank y'all for all of y'all's help and for everyone else's in this county, because they do play a great part, and they all help.
So that particular grant they send that information and it says the county judge is gonna fill out all this stuff and gather these
No way.
documents. And it took y'all 2 weeks to
Yes,
get
sir.
it done. I'm thankful for that. My goodness. That's awesome. So thank y'all very much.
You bet. Thank y'all.
Yes, sir. Did you want a picture, Dwight? Did you, or?
Can you get a picture of everybody, Robin?
I want to add to that the grant research program has been extremely helpful and profitable in filling gaps that the taxpayers didn't necessarily have to jump in and do, and it to the tune of more than $10 million in 3 years, actually closer to 14, 12 or 14, whatever it is. But it definitely a huge gap that's been filled by this program and has been beneficial to the sheriff's office directly and beneficial to the county as a whole in many areas. So thank you for your work, Dwight.
Yes, sir. Thank you.
All right.
Y'all want to come over here and get your picture made?
Why don't you get your grant task force, your main players up front?
I'm gonna wear my hat for this. There. Becky, you get on the front. I got mine too. Hey, congratulations on your win today.
Somebody's gonna act up every
Yeah. Come on. Sharon, come on.
Let's
Yep,
get
get you. Don't mind me. Okay.
in the back. Becky, you need a front.
Supposed to have a wide lens.
Look, for some of us more than others.
Make some of us turn sideways.
What are you really trying to say?
Well, I'm taller. I'll be right for it.
I gotta do is that name. You get back here.
I'll let Fat Man go
Thank y'all.
Thank y'all very much.
Appreciate all of you with the Pondex. Hey, appreciate it.
Thank you, Dwight. All right, George, thank you for bearing with us. Next up, item number 5, this is consideration and action regarding the approval of the 2025 Harrison County UHC Senior Supplement and Group PDP Prescription Plan Renewal as presented by George Harmon with the Nitsche Group. And this is going to include the county's health plan, our prescription drug plan, a number of things that's actually the renewal for our entire health.
Yes, sir. So we're going to go through, we're going to do 5 things here. And I'm going to try to silo each one of them so that we can vote at one time. They all go together. So we're going to go through your major medical plan, your self-funded, your partially self-funded plan. I'm going to recommend a change to your drug program that will provide some significant savings to the county for the 25 plan year. We're going to go through your ancillaries, which are your long-term disability, your vision, your dental, your term life and your supplemental life. Then we're going to go through this Medicare supplement. That's number 4. Some changes that CMS passed down to all their constituents. And then we're going to finally approve the Ameriflex third-party administration, which covers your COBRA, your child daycare services and such. So we'll do all 5 of those at one time, if that's okay. I'll try to get through this. I would like to say good morning to everybody, and I honestly never remember anybody taking a picture of the health consultant at a meeting, so I was a little jealous of that.
They already gone.
I know. Nobody ever asked to take a picture with me. Normally, I'm peeling rocks out of the parking lot on my way home.
We'll do that next year.
But not the case this year. You know, we talk about trend, and I mean, I'm very thankful and fortunate that we've had a 10-plus year relationship together, the Nitsche Group in Harrison County. So I've really gotten to see the growth of your plan. One thing that I would say that y'all have done at Harrison County is that, first of all, you listen to advice. You guys take advice very well, and that's what's the point of having me involved if you don't listen. And you certainly interject when you feel like you need to, but you guys have followed the plan, and the plan's really is working for y'all. I mentioned to the judge earlier, over a 10-year period, I think last year we kind of went through and I kind of gave a summary of what I felt like were the savings to the county over the last 10 years, and they're significant. I mean, they're significant, the savings, by being on this plan that comes with some disruption. And Yvette and Cheryl Lynn, they have to deal with some of that disruption, but they do a really nice job of navigating it. But the savings are so significant. I mean, it's really working out well. Most importantly, the cost. I don't think the employees have taken on any additional contribution cost, for at least 6 years. The judge and I contended, and I think we're going to be able to continue that for the 7th year this year. So I'll get right into the medical. So our partially self-funded medical plan, same third-party administrator, about 15 years probably. And then we have a reinsurer that was new last year, Symetra. And Symetra came to me about the 1st of August, and they offered what they call an early renewal. In Harrison County, we've never gotten that offer before, and that's just a underwriter, actuary looking at your plan and looking at the consistency of 5 to 6 years of data, and looking at your current state, which they did in July, and they felt like, you know what, this might be one, if we offered a very nominal increase, we might be able to get this one off the books, because it gets so busy for January 1, your effective date. So they passed it on. I sent it to the judge and Cheryl Lynn. I went ahead and committed to it. Of course, you're not tied to it, but it was such a good offer, we decided that it was probably the right thing to do. That kept us from rolling the dice if some catastrophic claims presented themselves in maybe August or September or even October, when most of these reinsurers are going to look at your claims through the month of September. They just looked at yours through the month of July, so that gave us 2 free months. So had something significant come up on August 2nd, they were locked in, and we got the benefit of that. So what they offered is, and let's just make an assumption, which is a true assumption, it's a fact. No benefit changes, no changes in your contract, no changes in your liability, and they delivered a 2.46% increase. Trend right now on medical is running right around 6.5 to 7. Trend on drugs is running around 8 to 8.5%. So, blended trend's probably somewhere closer to about 9.5 to 11. There's no way of really knowing on our partially self-funded plan, but I would suspect that your neighbors down the street are probably looking at some type of double-digit increase this year. It's just where everybody is. So 2.65%, 2.46%, that's just on your fixed cost. That's not on your overall liability. That's just your fixed cost. So that equates to about a $20,000 fixed cost increase for you guys for the 2025 plan year. Now, 8,000 of that is we're going to up our what we call our gene therapy program. So last year we implemented a gene therapy which kept you guys out of harm's way in the event that you had an employee or dependent that was prescribed a gene therapy drug. These drugs are incredibly expensive. They start around $350,000. They're often one time. A lot of times they're in embryo. They're incredibly expensive. They can be devastating to a plan. So our reinsurer has offered us a fully insured option, and they were covering 5 of these gene therapies for us this past year for $1.99 PEPM. Small price to pay, $2 a month, and we are not responsible if somebody is prescribed these drugs. It's taken out of our risk pool, right? We don't pay anything. They pay the drug 100%. Well, they've upped it this year from 5 drugs to 15, and because of that, there's a subsequent increase in the PEPM from $1.99 to $4.75. That equates to about an $8,000 annual increase for you guys, but the exposure, we get 3 times the drugs or double the drugs that we would have had covered. These drugs now, these gene therapy drugs, they have trickled into the category, and it truly is called a silo, and a lot of it is, they've come into transplants, bone marrows, blood transplants, infusions, things of that nature. They're becoming more and more of a risk for us. So I'm making the recommendation that we add those additional 10 drugs to our list for the additional $475. It's something we can look at 2 years from now. If we don't think our risk is very high, we can terminate that. But that is the substantial part of your $20,000 fixed cost increase, is just getting more coverage. So my recommendation on the spreadsheet is Renewal B, a 2.4% increase. No lasers on your group, meaning there's nobody that's been singled out. I will add too that I just looked at your updated numbers through the month of October, and you guys are running right at about 76% of your expected. That's fantastic. That's as strong as we've had in a long time. So 76%, meaning what the actuaries thought your claims would be, you're running at 25 points under. So I think we're in a great spot right now. Judge recommended Renewal B on the spreadsheet with Symetra, and that's $125,000 specific deductible on a paid contract. You guys have the strongest contract in the market. Coupled with that, let's talk about drugs for a second. If there's anything that we can improve on at Harrison County, it's our drug spend. So our drug spend is up just about $200,000 over the last 2 years. This is due to the fact that we have a higher incidence of specialty drug utilization. We have more employees taking more drugs. We have more dependents taking more drugs. It's not a trend that we're not seeing across the country, but we also at Harrison County have had a very relaxed set of rules, right? Every drug plan has a set of rules, and it starts with the formulary. I hate messing with formularies. I don't like it. What I do not mind doing is I do not mind asking our employees to go through a couple of critical steps before they get their drugs, asking the physicians to work with them to go through a couple of different steps. So our current aggregator, PBM aggregator, they're our consultant, Keenan, who's been on this case since 2017, no stranger to the Harrison County. They've come back with 3 different options. So let's just say this, there's 4 levels of DEFCON with drugs, and 1 being the most lenient and 4 being the most stringent. I'm going to make a recommendation that we go to 2. We're at 1 right now. Let's go to 2. The proposed savings to go to 2 for Harrison County for the 2025 plan year are $311,000. It's been my experience working with these aggregators for 6 or 7 years. I started working with them the second I could. I've got every single one of my cases is using an aggregator. We use 4 or 5 different ones out in the market, depending on which fits the best. It's been my experience that when I get an estimate of projected savings at $311,000, that's typically terribly conservative. It's usually under the market by 20 to 25%. And the reason is they have a performance guarantee. They're going to guarantee you that you're going to get the savings, you're going to get some money back. So they keep that number low. I want that number to be high, of course. But for $311, it's going to cost us 50 cents PEPM, or PMPM, per member per month. So we're right at 400 members. It's going to cost us $200 a month. I mean, to me, if we're going to spend $2,400 to save potentially $311,000, I'll put my reputation on the line that we will save at least $311,000. Then we're going to do it. What does it mean to the members?
Let me ask you a
Yes, sir.
What, you you said we're moving from level 1 to level 2.
I'm recommending going from the least stringent to the second least stringent.
What does that entail?
I'm gonna
is that
tell
what
you.
Okay.
Yeah, this is where we're getting at. So there's really three things in drug plans that impact the availability for your members to gain access to those drugs. And the first one is a prior authorization. Okay, so are we going to require a prior authorization? Which that means is that if I'm on a maintenance drug and I have, I'm taking a GLP-1, let's say, I'm taking Ozempic, and we're just going to require that once a year that our members go back and have their physician, their attending physician, give them the authorization, the prior authorization, that medication is necessary for another 12-month period. It's real simple. I mean, it's common sense. We should ask that they at least go back. We have a lot of members around the country who are getting drugs that they just don't need anymore because, you know what, they don't have a prior authorization. Doc just keeps renewing the script, falls through the cracks. Maybe they don't go back until, to get their physical like they should every year. So we're going to require the prior authorization. That impacts everybody. It's common sense. It's good common sense. We need to do that. The second thing that we can do is step therapy. And step therapy is that, we have 4 or 5 different drugs that treat, one condition. Well, one of them is going to be the least expensive and one of them is going to be the most expensive. Well, let's start with, if they're biosimilar in chemical compounding and chemical makeup, if they're biosimilar, then let's just require that we start with the least expensive. It may not be the one the member's taking, but you know what? It probably works the same. If it doesn't, they'll go back. But it's step. We're going to try and keep the costs down as long as we can. And again, I think that's good common sense. I think that's the right thing to do fiduciarily for the health plan, for the counties and the constituents' money. Let's just make sure that there isn't a drug that's out there that's, it could be 3% of the cost. I mean, let's give it a shot. If it doesn't work, then they'll step it up, and we'll keep stepping up. The third thing that's really important that doesn't get talked about very much is called drug quantity management. And so I was giving the judge an example. I had knee surgery this summer, and they sent me home with 62 hydrocodone. Okay, well, 62 hydrocodone, I didn't need 62 hydrocodone. I didn't need one, really, but they sent me home with 62. And, that's a complete waste of money to my health plan. That happens every single day. So if we had drug quantity management limitations in my health plan, they would have sent me home with 5 hydrocodones, right? It's like I told them, if I took 63 hydrocodones, I'd be living out on underneath a bridge on I-20. I would probably like it. We don't need to do that. We need to get our members the quantity that they need, the appropriate quantity. Oftentimes, the quantity is leading up to a surgery, or it's leading up to a visit. It's leading up to going to see a specialist. I'm going to put you on something for an endocrine issue that you're having. You can get in to see the endocrinologist in 6 weeks. Well, I'm not going to give you 120 doses of this medication. I'm going to give you enough for 6 weeks. So that's drug quantity management. It's the most least talked about, train wreck that we have in the pharmaceutical world right now, in my opinion. We're giving people too much. What happens to the excess? What happens to the pills and the medications, the shots, the injections that aren't being used? Nobody knows. So I'm suggesting that we put in level 2. It's called the Advantage package. Right now we're on what's called the limited package. The limited package is it's a very limited PA list. It's a very limited step therapy, and we're not getting much out of our DQM. So we're going to step it up. $311,000 is the savings. The impact, we got 143 drugs that are going to be impacted. Okay, so it's going to affect some members. Probably, my guess is it's going to probably impact about 50 to 60 members. It could be one of y'all. It could be one of them. But they have a very calculated, great program. We'll work with Cheryl Lynn in her office and Yvette, and they'll send out letters. They'll identify who they are. Once we give them access to the members list, they'll send the correspondence out, and they'll immediately start contacting the prescribing physicians to start trying to work on finding alternative drugs if it's necessary, if they have them. Not every drug is going to fall into the list. There's some drugs that there's no biosimilar for. There's some drugs that don't have alternatives. They don't have generics available. But if we can save $311,000, I think we ought to give it a shot. So I'm going to make that recommendation. I will tell you this, that nationally with this program, 63% of Keenan's clients, your PBM, your aggregator, are on the next level of stringency. So we're still not there yet. Now, if this works, and if this works, I'm going to come back next year and we're going to really shake it up. If our members take it well, and we get the savings we think, then I'm going to suggest probably a couple more things that we can do. There's a lot of cool stuff going on with international drug buying and things like that where we're really saving some money. But I want to make sure that we get through the disruption. This has always been a member-friendly group, but 311,000, my train of thought on this is that if we bumped up 211 or 200,000, just over 202, I think, over the last 2 years in our drug spend, let's reset the bar and get back down to where we were in 2021. And then we'll start again. And that's what's been so much fun with this group, for me, is that you guys are willing to do the things when they need to come up to keep resetting the bar, keep re-lowering the bar. So that's number 2. Medicare supplement. Medicare supplement is something that the county has been providing for employees. I think we have somewhere close to about 56 on the plan right now. We currently utilize United Healthcare. They're our carrier. They are going up. It's a fairly significant increase. We're going from $151.83 to $183.16 on the senior supplemental, and then the Part D supplement, $225 to $300. Now, with that, just so everybody understands, the max out of pocket on the drug plan is going from $8,000 to $2,000. So I don't see that as much of an increase for the member. That's a great benefit for the insured, for the supplement. But these increases, they were passed down by CMS. Every carrier is getting them. Every carrier is passing these off. I don't like them. We're not in the Medicare supplement business at Harrison County, but it's a benefit that we do provide. But these are budgeting corrections according to the Office of Center for Medicaid and Medicare Services that are just being passed off to the actual members. It's also based off of the disease state and the demographics of your particular group. So everybody's just kind of paying their fair share to catch back up to the market, if you will. So I think that's a pass-through. I think that you do have some, I'm not involved too much, but you do have some contribution being made by your constituents, by your retirees. But again, that's a pass-through, and there's a small number of folks that are on it. The third thing that we have here, or fourth thing that we have, are all your ancillary benefits. So you guys offer benefits in addition to medical to all your employees. You offer dental, you offer vision, you offer 2 life programs. One is a $20,000 term, one is a supplemental, where you allow at the member's expense, as the employee's expense, they can buy more insurance. And then, of course, you have a long-term disability plan, which I think is a great program. And I'm happy to report that we have rate passes on all of them, so there's been 0 network changes, 0 benefit changes, 0 carrier changes. This is all going to just roll over from 12/31 of 24 to 1/1 of 25, and it will be exactly the same. Just to remind everybody, we have a rate pass on the dental plan until next January, so we'll be looking at that next year. The vision, we don't have to look at it again until January of 2027. We don't have to look at the basic life until January of 2027. And the, I cannot remember on the supplemental life. I think the supplemental life is the same as the regular life, so that's going to be next year, 2026, I'll say, but that's not terribly important. There's a lot of different markets out there that will take our business. And then this is important, the long-term disability. We have a rate pass for the next 2 years, so we won't be looking at it until the 27 renewal cycle. So we have a complete, no change, just adopt the same plans that we had on all those ancillary products for 2026. So no additional expense to the county or the member. And then the last thing We installed a TPA last year to help you guys with the COBRA, the dependent daycare, the POP plan. It's all based off of employees' participation. If they want to participate, they don't. If you'll recall, we had a real mess a couple years ago. We had, we had so many different supplemental products and so many different moving parts, and we kind of kicked a lot of those out, and we kind of started over. And Ameriflex kind of manages all that for us. They charged us last year. They charged us a setup fee of $250. This year, there's no setup fee. They have an annual renewal fee of $185, which is contractual, and they charge us $50 a month, whether we use it or not. It's very inexpensive coverage. There's a 9-cent per participant increase from 86 cents to 95 cents for the COBRA access, which is really inexpensive considering the value. And then the FSA, your flexible spending account, $383 is the current rate per participant, and it's going to $405, so a 22% increase there. So my recommendations, I think Ameriflex has been, I think they've been easy to work with. I mean, it was a pretty easy install. I think they provided great communication back and forth between us and your offices. And my recommendation would be to remove that. So, to sum, on the medical, renewing with the incumbent Symetra for the reinsurance, take the 2% increase. Let's take the upgraded gene therapy program from 5 drugs to 15. And we'll take on the additional PEPM there to $4.79. We take the Medicare supplement, we go with the Advantage Plus program, which again is level 2 of the drug plan with a proposed savings of $311,000. We will start implementing that if you approve it today. So we will start the member notification campaign, which will be letters. It will only go out to those members that are impacted. Members in the future that might be impacted, they will find out at the point of service. When they go to their pharmacy to pick their script up or they call in for mail order, they will be red flagged and they will have somebody that will explain to them what the program is and how it could impact them positively. Lower costs. We want to lower their cost. If we can lower their cost and lower their max out of pocket, lower their spend and their copays, it's a good thing for them too. I would also like to say with the medical plan, it would be my recommendation based off of your factors, which is your claims experience, predictives, if you will, that it would be my recommendation for Harrison County to keep the employee contribution the same as it was in the current plan year, the same it is currently. I would not recommend any increases at this particular time. Your exposure has not changed. I don't see anything in the trends that's impacting you guys negatively, and I also have expectations that we're going to save some additional money on the drug plan this year. So I suspect that for budgetary purposes, what we did this year, I think, Judge, you guys, did y'all put about a 6%, 7% increase in the surplus for the budget?
I don't remember what we increased, if
Remember?
at all.
You didn't? Yeah, you should be just fine.
You had mentioned earlier that, so you've been discussing with us basically our administrative costs.
Yeah.
But our overall spend, you said it's about 77% of.
Your claims were at about 77% of what they predicted. So yes, well under what you.
Fantastic.
Yeah, look, anything under 80% is in the 5th percentile or the 95th percentile in my experience. And 31 years of doing this, I mean, I'm targeting, if I can get groups at 85 to 90%, then we're going to be able to find ways to continue to make budget. 75% where you guys are currently for this year, I mean, I just added in 2 points just kind of as a little buffer, but I don't see how it could possibly go up 2 points. We only have 3 months left or 2 months left. But your exposure, it's a big deal. I mean, your exposure is it's just not going up. I mean, you guys are just maintaining, a flat line.
So this 2% increase we're talking about is just our admin cost. It's not our overall claim cost, which is.
It's just your admin costs. So, Judge, we're literally talking about $14,000. And 8% of that is applied due to us taking on less risk with the gene therapy drugs. That's something that I'm just making a recommendation that we do. Let's just keep building the surplus and keep building and keep building. If we can buy cheap insurance, let's do it.
You're talking about less than $6,000-7,000 for the year when you take out the increase on the
That's correct.
$8,000, as far as.
That's correct. Countywide, we have 400 and we have 304, 400. We have 400 total dependents on the plan and members. I mean, that's pretty substantial that we're able
My
to.
only question is in the increase on the drug side from level 1 to level 2, and I think it, but I want to ask you, we're not actually putting any more responsibility on the patient themselves. It's going to be on the doctor that's
Correct.
prescribing these medicines.
Correct.
Or refill or whatever.
Correct.
Because
Correct. So let me be clear. I mean, disruption happens every day. I mean, if you're on a fully insured Blue Cross Blue Shield or United plan, I mean, you're going to get a letter. I'm on United. My group's too small. My company is too small to do what you do. I wish we could do what you do, self-fund. But I got a letter in the last month. I remember seeing it. Changes coming to your health plan. And it was a formulary change they were notifying me of. Now, you think I'm going to go online and look up but they're constantly shuffling drugs around that they think are too expensive or they can get a better deal on this one. And I mean, they're looking to make money too. I mean, the largest PBM in the world sold 2 years ago for $86 billion. I mean, you think they're making any money? So, but they're still trying to cut their costs too. They're trying to increase their bottom line. So to be clear, there is disruption. We got 144 scripts that we know are going to be impacted as of right now, or as the time this report was done, which was sometime in August, early September. So it could be that you have a member that is going to get a phone call and say, hey, Zentide is not covered anymore, and you need to go to Celeste, which is a alternative, and it's what we're going to do for step therapy. We're going to try it. Your physician says it's okay to do it, or the physician will call and tell them. So I don't want there to be like, hey, it's just not going to be anybody, but we have a very small number of, we have 144 drugs. I mean, that's probably going to end up being about 50 people. It's not going to work for everybody, but there's enough savings there to generate $311,000 of bottom line return for y'all at 50 cents PEPM. Let's do it.
Let me ask you, what happens if out of these 50 people that there's not an alternative for them through their physician, or he just refuses to change them from what the recommendation is? Do they still get what they're taking?
Correct.
Okay. It's just a higher cost to us.
Correct.
Okay.
Correct. It's not always a fit. There'll be cases where somebody has been on a maintenance drug for 30 years, and the physician is going to say, we've tried this, and this, and our PBM, now remember our PBM, Keenan, I mean, they're PharmDs, they're pharmacists. They're not, these aren't just account managers and account reps that sit in the back, of my office. I mean, we have real pharmacists that are talking to other pharmacists and talking to physicians. And so they communicate, they look at medical records. If it doesn't work, it doesn't work. They're not going to peel somebody back when they've had a bad experience trying the step therapy. They're just not going to do it. They're not going to make them go through it.
I guess for me, I just want to make sure that our members, in the event that there's not an alternative, they're not denied.
Correct.
What they need.
We're not excluding any drugs,
Okay.
if that's what you're asking. There's no drugs that are excluded on the list.
It's just a possible swap from one to another.
Correct.
If it works.
Correct. Yeah, we have our formulary is wide open. We have access to all the drugs that are out there. We just don't, we don't want to use the most expensive drugs unless we just absolutely have to. And there are times we have to. There are times that we have to.
I've
So-
gone through that before, where the insurance company suggested another drug for my diabetes, but they had to convince my doctor, to try this particular drug, and then it outperformed the one the most expensive drug that I was on.
Right.
That's great.
And that's a great anecdote, because I mean that happens all the time. Why are our members on certain drugs? Oftentimes we don't know, because they just always have been. You know, but when we have clinical expertise, I mean that's what's so fantastic about groups like Keenan. I mean they are clinical experts. They are not out to try to keep you. Remember, we don't pay Keenan. They don't get any percentage of profits. We pay them a straight PEPM. It does not matter to them what you spend your money on. We pay them a PEPM. There are PBMs out there that we get 100% of our rebates. We're going to collect almost $400,000 of rebates back from our spend this year when it's all tallied up. Now, we won't know the exact number until sometime in May probably, but they don't take any of it's a 100% pass through.
But I think it's important that those savings that are generated stay in our health plan. It's not like we're trying to save money to keep or to slide money somewhere else. The savings that are generated, correct, that are on our health plan stays in our health plan. Is that right, Ben?
Yes. I mean, there will be, the way that you can monitor that is because each payroll we deposit within the contributions from an employer and employee. And we just had an agenda item for the ratification of $200,000. It's when we have to pull from the county to deposit into these accounts that are paying the claims. That's how you know if the county's covering all of it. Last year, we did not have to transfer any money from indigent to cover the claims. The year before last, we had to pull money from our indigent line item to cover the claims for our employees. That did not happen this year. So I can see where we're only at 76, 77% in claims, because we're not seeing the claims
Right.
on a weekly basis as we pay them.
So when you guys get, I think this is part of what you're asking, when you get it, because we have the PBM, we have them send your rebate checks directly to you.
Yes.
And what you have two options, and I just carte blanche do it for all my clients. What they want to do is they want to send it to the third party administrator. And the third party administrator wants to give you a credit. I don't think I don't like the accounting that you would have to do. So I just have the checks, I circumvent that and have the check sent directly to y'all. So when you get one of these checks every quarter, do those go into do you deposit those into your health fund account?
Yes.
So there's your answer. So she's doing exactly what I thought she was. That money is being used to offset or to pay, not offset, but to pay
Well, I
future
just think
claims.
it's important that our employees know
Yeah.
that we're not sitting here making decisions based on trying to save funds and yet taking something away
Right.
from them, that any savings actually benefits, because my goal is at some point we get to a point where we're safe enough that you don't have to pay $30 a payday, or it drops to $15 a payday,
Sure.
or whatever, because we've managed our plan to a point where it's doing what we all hope it would do. So, I mean, I'm not saying that's gonna happen, but I think that that's your goal, long range, is that, that your employees are covered, and number one, they realize that they're getting what they need, and we're not trying to cut corners
Correct.
and hold back from, I just don't want the employer to think that we're sitting up here basing decisions solely on, does it save $1?
Right.
That's for me.
Yeah, and I will say the recommendation to save $311,000 by tightening the drug plan down it's the $311,000 that will stay in the claims account. And year over year, and the way I look at all these is it's over a 5-year period. 300 may not sound like a lot to a lot of people, it does to me, but 1.5 million does over 5 years, which will be here before we know it. I mean, I've been standing up here for 10 years, 11 years as it is. I mean, it will be here before we know it, and it's just a smart thing to do, and we've got to keep chasing it. But you guys have made minimal disruptive moves to your members compared to most groups.
Well, and I think there's some benefits that even, we sit up here and listen to the presentations that I don't even realize are part of the plan.
Right. So
You're not gonna have the Blue Cross or Aetna or any of those,
Yeah, I mean, we would not be having these conversations if we were with Abuka. I mean, it was really it was a strategic move to kind of go boutique and kind of put our own plan together. And like I said, I mean, you can ask around town and ask what other employees at other groups are seeing, and I think they're probably seeing close to double-digit increases every year. It's the landscape is not great right now on the fully insured side. Charlene, did I stop somewhere? I was trying to help you make sure you had it all. You got everything that we went through? Okay, because we have the supplemental, and then of course we have the ancillaries, no change, and then of course we have the FSA, the POP, child daycare administration with Ameriflex. So those are the 5 items that I would like to get approval on today, so that we can move forward and we can go ahead and start implementing some of these improvements in anticipation of the 1/1 effective date.
Very good. I guess one comment I'd like to make is what you're doing is really trying to manage our plan. Every year, we're seeing increases. Our insurance not going down, but we have not passed on any increases because we're managing it well. We've not had to pass that on to our employees. So that they're still getting great coverage at a great cost, and we're not reducing their coverage at all.
correct.
In fact, you're improving it on the gene therapy stuff.
Absolutely.
We're managing our prescriptions. Our pharmacy manager is helping us with that so that we can tighten up our belt on $300,000 worth of possible savings there. I think that's just being a good manager of our plan, so I appreciate you looking for those.
Absolutely. I mean, like I said at the beginning, Judge, I appreciate the fact that you guys are open to changes. We don't make a lot, but I mean, this is it's a big deal to stay on top of it, to keep chasing the market.
Yeah, for us to have virtually the same coverage at the same cost to our employees is pretty unheard of.
Right.
It just doesn't keep happening year after year, but.
I would
you've been
agree
able
with
to do
that.
it, so thank you. Is there a motion to approve?
Second.
Motion by Commissioner Ebar, second by Commissioner Timmons. Any other questions or comments? All in favor? Aye. Any opposed? Hearing none, our motion passes 4-0. Thank you, George.
Yes,
Very
sir.
good. We'll get this executed for you and back to you. We have no calls to go into executive session today, so we'll skip items 6 and 7. That brings us to our last item. That's a motion to adjourn.
Motion. Second.
Motion by Commissioner Timmons, second by Commissioner Ebar. All in favor? Aye. Any opposed? Hearing none. Motion passes 4-0. We're adjourned. It's 11:02. Thank you all.
People pick these up.
Yeah.